There are some misconceptions about female anatomy. So can you just highlight those points?
Absolutely, Dr. Vaidya. It's essential for every woman to know what is normal so that she can identify what is abnormal and come to an early diagnosis. So fibroids can be of various sizes. They can be grain sized 4-5 millimeters to huge football sized ones 15-20 centimeters.
So it is always a good idea to see a gynecologist, and the gynecologist can do an internal examination and sometimes may feel the fibroid. And if that doesn't happen, then the other modality would be, I assume, a sonography. We would encourage our women viewers to have a low threshold, so to speak, to undergo a sonography after they see a gynecologist.
A lot of women to me, in fact, have come with vague symptoms of tiredness. And on checking them, we have found that their hemoglobin is very low.
The normal hemoglobin is usually for a woman is 11.5 to 12. That should be the where your hemoglobin should be. They get symptoms such as bloating, sometimes diarrhea, abdominal pain, sometimes vomiting, and you have to take it for a very long period of time.
Yes. Sometimes I think women just need that little bit of push. Maybe a single dose also will make a very big difference.
Absolutely.
So at Horizon Prime Hospital, we try to make the birthing experience a comfortable one. But significant amount of pain comes down, and most women are comfortable throughout the labor process thanks to the epidural analgesia.
Epidural. Okay. Welcome to today's podcast. I am Dr. Hrushikesh Vaidya, Medical Director of Horizon Group of Hospitals. I am also a practicing pulmonary and critical care physician. Today, we are going to talk about women's health. We would like to make a point that this podcast does not intend to treat or diagnose any medical conditions, but is for only educational purposes. Today's guest is Dr. Manali Shilotri. She is a consultant gynecologist and obstetrician at Horizon Group of Hospitals. She has done her MBBS from KM Hospital, followed by MD from the same institute. She is also a member of Royal College of Obstetrician and Gynecologist, and she has done 1-year fellowship in minimally invasive, which is also known as Keyhole surgery from Kochi. Welcome, Dr. Manali.
Thank you so much, Dr. Vaidya, for having me here.
So let us start with some basics. Many viewers would like to have an overview about the female anatomy. There are some misconceptions about female anatomy. So can you just highlight those points?
Absolutely, Dr. Vaidya. It's essential for every woman to know what is normal so that she can identify what is abnormal and come to an early diagnosis. So the female reproductive system has basic organs like the ovaries, which produce the female sexual hormones and also have the eggs, which contribute to a pregnancy, 2 fallopian tubes, the uterus or the womb, the mouth of the uterus, which is the cervix, and the vagina, which is the birth canal or from where the menstrual blood flow comes out. So the ovaries are the main female organs because that's where the female hormones influence the overall health of the woman in terms of her heart, brain, bone health, and etc. Whereas the uterus or the womb is to provide a safe haven for a pregnancy. It itself does not produce anything. So this is a very common misconception that menopause means the uterus stops functioning, which in a way is true, but it actually means that the ovaries have stopped functioning. So the main organ I would stress upon is the ovary, while the uterus has a major role in terms of pregnancy only.
So these are important things to know, that the ovaries produce the hormones,
Yes.
the uterus carries the baby, and then the birth canal, which is the vagina, which is an important conduit and also used for sexual function.
Yes.
So nice to hear that. So the important part that you have covered is the anatomy. Now let us talk a little bit about some disease processes that happen in these organs. Now we hear a lot about fibroids.
Yes.
Fibroids is an extremely common condition. Many women have it. There are sometimes symptoms, sometimes not. So can you highlight a little bit about how fibroids form?
Yes.
Are they cancer? And how are they diagnosed and treated?
So fibroids, like you mentioned, are very common. They are lumps, ball-like lumps that form in the muscle part of the uterus or the womb. Now, we honestly don't know why they come up, but they are pretty common, and almost 50 to 60% of women may have fibroids.
So a lot of women have fibroids.
Yes.
Okay.
So fibroids can be of various sizes. They can be grain-sized, 4-5 millimeters, to huge football-sized ones, 15-20 centimeters.
So a lot of variation.
Yes. And hence the symptoms also vary a lot. They may come with symptoms of heavy periods, very painful periods, or pressure symptoms where they may feel like they're bloated all the time, they have pelvic pressure, or they may need to pee frequently. So it's always a good idea to get checked as to why these symptoms are happening.
So it seems like they are fairly benign but can cause symptoms and are extremely common. So it is always a good idea to see a gynecologist, and the gynecologist can do an internal examination and sometimes may feel the fibroid. And if that doesn't happen, then the other modality would be, I assume, a sonography.
Yes,
right?
absolutely.
Yeah.
So fibroids are fairly easy to diagnose. Sonography is a straightforward test which doesn't require any preparation, and we can pick up almost all fibroids that way. It's only when we plan treatment that we may require more tests like MRIs.
Right. So one point for our viewers to make it clear is that fibroids are not cancerous for most part and can be easily diagnosed by either a physical examination or a sonography or both. And one thing about sonography is it's done in short amount of time. It is fairly cheap to do it. And the third important part on sonography is there is no radiation.
Yes.
So no radiation involved.
No
right?
pain involved.
No
either.
pain or no radiation.
Yes.
So it's absolutely a painless procedure.
Yes.
So we would encourage our women viewers to have a low threshold, so to speak, to undergo a sonography after they see a gynecologist.
Yes, sir. In fact, some women may not have any symptoms at all.
That's
and
right.
they may find out about their fibroids because they have undergone a sonography. Which
So-
is always a good idea
Good
because
idea.
you can follow up on it.
Right. So a good thing to know whether you are having fibroids or not for multiple reasons. So that's
Yes.
very nice to know. So now, Dr. Manali, once a woman knows she has fibroids, then I think you already mentioned that not everybody would require treatment. But if they do require treatment because of symptoms such as bleeding, heavy bleeding, or they require treatment because of pressure symptoms, which they are having to go to bathroom again and again. So in such scenarios, you may require treatment. So what are the treatment modalities?
Right. So it all depends on the severity of the symptoms. So like for example, bleeding, if it is mild, then just non-hormonal pills will work.
Okay.
Sometimes we need hormonal pills, which is a course, and sometimes we may have to resort to surgery.
So you would first maybe, if possible, try to give the medical treatment, which will involve some pills, hormonal or non-hormonal. And if that doesn't work and the symptoms are still there, then there are some surgical options
Yes.
which may be required.
Yes.
That's right.
So luckily now surgery doesn't mean a very big deal as in the past. We have minimally invasive surgery now. So we can deal with most fibroids that way.
So as you have done a fellowship in that, you would be the right person to decide which patients would need minimally invasive surgery, which can be done with just keyholes,
Yes.
right?
Yes.
That type of treatment where the patient can maybe walk the same day.
Yes.
So it is absolutely minimally invasive. So those surgical options are there, and they can be fairly safe and easy to perform for the
Yes.
patient.
Yes. So unlike traditional surgery where we have to open the tummy to almost a 15-20 centimeter cut, in minimally invasive surgery we hardly have half a centimeter cuts. They're single stitches. So the pain component is much lesser, recovery is much faster.
So pain is less, recovery is fast, and the patient can get back to work quickly.
Yes.
Or their activities fairly quickly.
Yes.
Very nice to know. Okay.
Dr. Vaidya, since we are discussing fibroids, a lot of women to me in fact have come with vague symptoms of tiredness. And on checking them, we have found that their hemoglobin is very low. Anemia is very common in women. So could you highlight a little bit on what we do now with cases of
Yeah.
anemia?
So very, very nice to hear that you are picking up these cases, because there are a lot of women walking around doing their everyday activities with a very low hemoglobin. So the normal hemoglobin is usually for a woman is 11.5 to 12. That should be the where your hemoglobin should be. But we are seeing a lot of women chronically are losing blood because of heavy menses over the years, and their hemoglobin drops and their iron level also drops. So in such cases, they have symptoms such as fatigue, tiredness, weakness, inability to concentrate, overall not feeling well. And sometimes for a woman, this is blamed on, her, stress or things like that, that maybe the working.
They tend to ignore
They
it.
tend to ignore it.
Yes.
And when we check their hemoglobin, as you said, the hemoglobin comes very low. There is also a category of women where the hemoglobin is just at the lower level of the normal, but when we check their iron levels, they are severely iron deficient.
Right, absolutely.
And this is absolutely a treatable condition. So in the past, we used to focus as physicians, we used to focus on giving iron orally if possible. But the problem with that is a lot of patients do not tolerate oral iron.
Right.
They get symptoms such as bloating, sometimes diarrhea, abdominal pain, sometimes vomiting, and you have to take it for a very long period of time.
Yes.
And the prior iron injections were having high risk of reactions. But now we have a new molecule, but there are different molecules that are available which are given once a month, and their hemoglobin with just 1 gram can be brought from a very low level to normal.
Right. Sometimes I think women just need that little bit of push. Maybe a single dose also will make a very big difference.
Absolutely, absolutely. So it is very important to pick up iron deficiency when we can treat it. Also, another culprit we are seeing is vitamin B12. Vitamin B12 being low in patients can result in anemia. It can result in sometimes nerve issues. People can get tingling, numbness of the nerves.
Yes.
Weakness, fatigue. And if it continues for a very long period of time, you will be surprised to hear that there are cases of dementia.
Oh my.
So patients
quite
become
serious.
They get their brain affected because of severe B12 deficiency. So we are very, very keen to treat all these vitamin nutritional deficiencies. And as a matter of fact, in foreign countries, especially I think in US and Europe, they are supplementing their breads with iron. So to prevent this in a long term.
Absolutely.
So this is a problem that needs to be identified and treated
Right.
on a very regular basis.
And I believe most of these injections are painless. Don't take much time, maybe just 30-40 minutes
40
a day.
minutes of one IV infusion.
Yes.
And I hear a lot of patients saying that I'm feeling much better.
Yes.
After a few days of that injection, patients feel
Right.
much better.
Right. Yes.
So I think that's very important for the gynecologist to look into that part and pick up those cases so we can help more and more people.
So I think for women, nutritional deficiencies is also a very important aspect that we
Aspect of
should be.
better health.
Yes,
Better.
yes, absolutely.
So, Dr. Manali, now let us go a little bit lower on the organs that you described. So, first you talked a little bit about the hormones secreted by the ovaries. Then we came to the uterus and fibroids. And going a little lower down, we will talk about the cervix. Now, the cervix is an important organ which basically is important because it can cause cancer.
Yes.
And now we know that the cancer can be prevented from spreading early on. And also there is now a vaccine.
Yes.
So can you highlight on that?
Yes. So we are living in a wonderful era of lot of advancements in science, and cervical cancer of the cervix is one of the few preventable cancers by a vaccine. And this vaccine is like a routine vaccine, so you don't need to go out of the way. And we recommend the vaccine to be taken in women prior to starting their sexual activity. So we are now targeting teenagers or women in their early 20s. In fact, the Indian government is even thinking of bringing it into the standard vaccination schedule for children.
Okay. So one important point that I think we need to tell our viewers is that cervical cancer can be diagnosed early on, and can be completely cured. So there is a test called pap smear,
Yes.
which I think every woman should undergo once a year.
Yes. So all women are recommended to undergo this test. It's called the pap smear.
Pap smear.
So it just involves visiting the gynecologist, undergoing a routine checkup. It is a relatively painless test, does not require any preparation of any sort. And if it is normal, once done, then you can actually come back every 3 years. So
Every
it's
3
not
years,
going
not
to-
even a 1 year.
Yes.
Okay.
So now we have got newer tests.
So I think it's very, very important for all women to undergo pap smear.
Yes.
So pap smear being normal, you are pretty much ruling out cervical cancer,
Yes.
and then repeat it after 3 years.
Yes.
So that's very important.
And it doesn't take much time at all.
And it is fairly cheap and
Yes.
relatively easy to
Accessible,
do.
yes.
Accessible,
Yes.
easy to do. So pap smear being a very important test. And the second point that I'm again trying to stress on is the vaccine. And the vaccine is better given to women before they start sexual intercourse.
Yes.
So that's a very important thing that even the Indian government is thinking now to
Yes.
introduce, it looks
Yes.
like. Okay. So these are two important things about cervical cancer, because if cervical cancer picked up early is completely curable,
Yes.
right?
Yes.
Okay. So very nice to know that. So Dr. Manali, you are an expert in keyhole surgery. So I would assume our viewers have similar questions about that. So you have mentioned that the keyhole surgery involves small incisions. There are no big incisions. The surgery is quicker. The recovery time is less. And I think the overall patient pain perception is also less. So can you highlight a little bit about that?
Yes. Since the cuts are very small and most stitches are absorbable, there is no significant component of pain. Having said that, what we did traditionally in open surgeries, your outcomes will not change. In fact, the results that we want will always remain the same. Sometimes they're better with the keyhole surgery because the vision is much better.
So when we talk about removing the womb or hysterectomy, which many women have to undergo for multiple reasons, the keyhole surgery or minimally invasive surgery is a best form of surgery.
Yes.
And the studies have shown that.
Yes.
Right.
So I think a very major component of fear of uterus removal is that one, it will affect their overall health, which is untrue. If we don't remove the ovaries, her health will remain the same.
Remain the same.
It's just that she will stop getting periods, but that will also mean that her period problems will get over. So she will have a much better life.
So in cases of heavy bleeding and where the family is done, hysterectomy can be a good option for patients.
Yes.
That is a very important thing for our viewers to know. Secondly, sometimes there is a question whether removing the uterus will affect the sexual health. Can you highlight a little bit on that?
So, Dr. Vaidya, absolutely, that's a very common question. And I wish to tell women this, that no, the sexual experience for both her and her partner does not change at all after the surgery. There is some care to be taken for a few days because it's immediately after surgery.
Absolutely.
But in the long run, there is no difference at all.
So long run, there is no difference in sexual experience for the husband as well as the...
So in fact, a lot of women have this perception that there is a loss of femininity. So I would like to tell them that is absolutely not
untrue
true.
because the uterus itself is not producing any hormones, as you mentioned in this thing. And the ovaries, if kept intact, there's no reason for them to have that. Okay, very nice to hear. Now, Dr. Manali, as you being an obstetrician as well, a lot of women, especially first-time mothers, will have a lot of questions about the childbirth experience.
Yes.
And at Horizon Prime Hospital, we have an exclusive maternal and fetal unit where we deliver a lot of patients and take care of a lot of patients. So can you highlight some concerns that a new mother may have during childbirth?
Right. So let me just tell you a little bit about what childbirth involves. So natural vaginal birth is truly a miracle of nature. And a lot of things are happening in tandem and in rhythm. So the muscle part of the uterus is contracting, trying to push the baby out. The birth canal, the cervix is opening up so that the baby can smoothly come down. And in these processes, the baby is delivered out. So sometimes when these things don't go in a rhythm, or we have some problems in the form of an improper position of the baby, the baby's heartbeat going up and down during this entire process. Or sometimes the afterbirth, the placenta is blocking the passage for childbirth. We may have to resort to cesarean section. But most women who have no other complications of pregnancy can absolutely go through vaginal birth.
So seems like as doctors, we would encourage a vaginal delivery
Yes.
for multiple reasons.
Yes.
And if that is not safe, and that is not safe for the mother as well as the child or both, then we would resort to cesarean section.
Yes.
Right?
So cesarean section can be life-saving
Life-saving.
sometimes for both the mother and the child. And I think in today's era, we should think of a safe outcome and a happy outcome rather than the rigidity of did a cesarean
What-
section happen or a
what would
vaginal.
it-
Yes.
So generally, I think we would encourage our viewers to listen to their doctors
Yes.
and have a open discussion on which method of delivery is safe.
Yes.
So in general, the thought process is the priority is to go for a regular delivery, vaginal
Absolutely.
delivery for
Yes.
multiple reasons.
Yes.
And if that's not feasible or safe, then you would resort to C-section.
Yes. So at Horizon Prime Hospital, we try to make the birthing experience a comfortable one. So pain factor, I think a lot of women have an issue with.
So good you brought it up that I think at our hospital in Horizon Prime, we have methods to minimize the pain.
Yes.
Can you highlight a little bit on that?
Yes. So we offer them something called as epidural analgesia.
Epidural.
Yes. So what the epidural essentially does is reduce the amount of pain. I wouldn't say it is painless as is traditionally thought, but significant amount of pain comes down and most women are comfortable throughout the labor process thanks to the epidural analgesia.
Epidural. Okay. So for our viewers who don't know what epidural is, they put a small catheter in the spine near the nerves and they inject an anesthetic agent. So the pain is reduced significantly and the mother can make it bearable to deliver.
Yes.
Is that
And-
right?
Yes. And she is able to push through
Push
labor.
through as
so
well.
her contribution and her experience of the whole thing just gets better.
Just get better. So it is something to help the mother and still have a normal vaginal delivery.
Yes.
And we are doing that pretty regularly at
Yes.
our hospital
Yes.
with very good results.
Absolutely.
Very nice. So Dr. Manali, what is special about the women's wing at Horizon Prime Hospital where you work?
Yes. So we have this wonderful floor that is dedicated to women's health. So when women come to us for deliveries, they are in a safe and comfortable environment with good support staff, nursing staff, doctors. Everybody is there to help her, aid her in terms of pain, in terms of helping her through the birthing process. And even after the birth of the baby, we have our lactation consultants and all of us helping her out to transition from the pregnancy to taking care of her young one. So I think most women will find it a very
Find it.
comfortable
So
experience.
it's on one simple floor, single floor to
Yes.
everything is available.
Everything is
there.
at the same
NICU is
spot.
also there, and I
Yes.
think that is a very good experience for the mother.
Yes.
Thank you, Dr. Manali, for being a part of this program. I thank my viewers for listening. This was Horizon Prime Hospital Women's Wing Talk. Stay informed, stay healthy. Until next time.